Question 1. A CNA is caring for a resident who has fallen. What is the most immediate action the CNA should take after ensuring the resident is safe? A. Move the resident back to bed. B. Report the fall to the nurse immediately. C. Document the fall in the resident's chart. D. Complete an incident report form. Answer: B. Report the fall to the nurse immediately. This question tests your understanding of immediate safety protocols and reporting procedures. The key phrase, most immediate action, indicates what needs to happen right away after ensuring the resident is not in further danger. After making sure the resident is safe and not in immediate distress, the CNA's top priority is to inform the nurse, as falls can indicate underlying issues or cause injuries that require a professional assessment. Moving the resident or documenting the fall comes after the nurse has assessed the situation and given instructions. Always remember, the nurse needs to know about any change in a resident's condition or any incident right away to ensure proper medical evaluation and care. Question 2. Before assisting a resident with ambulation, what should the CNA always ensure? A. The resident has eaten a full meal. B. The resident is wearing non-skid footwear. C. The resident has just used the bathroom. D. The resident's room is completely dark. Answer: B. The resident is wearing non-skid footwear. This question focuses on safety precautions during resident ambulation, which is a key part of preventing falls. The phrase "always ensure" highlights a critical, consistent safety step. Non-skid footwear provides necessary traction, significantly reducing the risk of slips and falls when a resident is walking. Other options like eating a full meal or just using the bathroom are not universally required for safe ambulation, and a dark room would actually increase fall risk. Always remember that good footwear is a simple yet crucial step to keep residents safe while walking. Question 3. Which of the following is an example of objective information? A. The resident states, "I feel nauseous." B. The resident appears to be in pain. C. The resident's skin is warm and moist. D. The resident is upset about their family visit. Answer: C. The resident's skin is warm and moist. This question tests your understanding of objective versus subjective information, a fundamental concept in documentation and reporting. Objective information is factual, measurable, or observable through the senses, meaning it can be seen, heard, smelled, or felt. The key phrase "objective information" points to data that is not based on opinion or what the resident states. The resident's skin is warm and moist is something a CNA can directly observe and feel, making it objective, unlike a resident's statement or a CNA's interpretation of their feelings. Always focus on observable facts when asked for objective data. Question 4. When assisting a resident with a weak side to dress, which side should be dressed first? A. The strong side first. B. The weak side first. C. It does not matter which side. D. Dress both sides simultaneously. Answer: B. The weak side first. This question addresses proper technique for dressing a resident with a weak side, which is crucial for comfort and preventing injury. The concept tested is dressing technique for individuals with unilateral weakness. When dressing, the weak side should always be dressed first to allow for easier manipulation of the garment over the impaired limb without causing unnecessary strain or discomfort. Conversely, when undressing, the strong side comes off first. A good way to remember this is, on with the weak, off with the strong. Question 5. What is the most important reason for a CNA to accurately measure and record a resident's intake and output, INO? A. To determine the resident's food preferences. B. To monitor the resident's fluid balance. C. To assess the resident's cognitive function. D. To plan recreational activities for the resident. Answer: B. To monitor the resident's fluid balance. This question tests your understanding of the purpose of measuring intake and output, INO. The key phrase, most important reason, directs you to the primary clinical purpose. INO measurement is vital for monitoring a resident's fluid balance, ensuring they are not becoming dehydrated or retaining too much fluid, which can indicate serious health issues. For example, if a resident's intake is significantly lower than their output, they might be at risk for dehydration, which the nurse needs to know. Remembering that INO directly relates to fluid status helps you choose the correct answer. Question 6. A resident constantly attempts to get out of bed without assistance, despite being instructed not to. What is the best initial action for the CNA to take? A. Apply a restraint to the resident. B. Place the resident in a wheelchair near the nursing station. C. Engage the resident in a supervised activity near the nursing station. D. Tell the resident's family about the behavior. Answer: C. Engage the resident in a supervised activity near the nursing station. This question addresses how to manage a resident at risk for falls or wandering, focusing on person-centered care and safety. The phrase best initial action implies looking for the least restrictive and most proactive approach. Engaging the resident in a supervised activity or placing them where they can be observed addresses the underlying need for movement or attention while maintaining safety without resorting to restraints, which are a last resort. This approach respects resident rights and promotes well-being by diverting their attention constructively. Question 7. A CNA is assisting a resident with perineal care. Which direction should the CNA wipe? A. From back to front. B. From side to side. C. From front to back. D. In a circular motion. Answer: C. From front to back. This question tests a fundamental skill in personal care, specifically hygiene practices to prevent infection. The concept being tested is proper perineal care technique. Wiping from front to back is crucial to prevent the transfer of bacteria from the anal area to the urethra or vagina, which could lead to urinary tract infections, UTIs, or other infections. For example, when providing care for a female resident, always ensure you are wiping away from the urinary opening. Remember this simple rule: front to back keeps the bacteria out. Question 8. What is the correct term for difficult or painful urination? A. Polyuria. B. Nocturia. C. Dysuria. D. Oliguria. Answer: C. Dysuria. This question tests your knowledge of common medical terminology related to urinary elimination. The concept is understanding specific terms used to describe urinary symptoms. Dysuria is the medical term for painful or difficult urination, often indicating a urinary tract infection or other urinary system issues. Polyuria means excessive urination, nocturia is frequent urination at night, and oliguria refers to scant urine production. Knowing these terms helps CNAs accurately report observations to the nurse. Question 9. When should a CNA wear gloves? A. Only when dealing with body fluids. B. For every resident interaction. C. When there is a risk of contact with blood, body fluids, or mucous membranes. D. Only when a resident has an infectious disease. Answer: C. When there is a risk of contact with blood, body fluids, or mucous membranes. This question assesses knowledge of standard precautions, a cornerstone of infection control. The concept is knowing when to use personal protective equipment, PPE, specifically gloves. Standard precautions dictate that gloves should be worn whenever there's a potential for contact with blood, all body fluids, except sweat, non-intact skin, and mucous membranes, regardless of whether a resident is known to have an infectious disease. This protects both the resident and the CNA. Remember that gloves are your first line of defense against germ transmission during care activities. Question 10. A resident with dementia becomes agitated and starts yelling. What is the best initial response from the CNA? A. Tell the resident to be quiet. B. Ignore the resident's behavior. C. Approach the resident calmly and try to identify the cause of agitation. D. Leave the room and report the behavior later. Answer: C. Approach the resident calmly and try to identify the cause of agitation. This question tests the CNA's ability to respond appropriately to challenging behaviors in residents, especially those with dementia. The phrase "best initial response" suggests a person-centered, de-escalation approach. Approaching calmly helps prevent further agitation, and trying to identify the cause, e.g., pain, hunger, fear, discomfort, is crucial for addressing the resident's unmet needs. Yelling back or ignoring the resident would likely worsen the situation, while leaving the room delays necessary intervention. Always remember to approach residents with dementia gently and try to understand their communication. Question 11. How often should a resident's position be changed to prevent pressure ulcers? A. Every 4 hours. B. Every 6 hours. C. At least every 2 hours. D. Once a shift. Answer: C. At least every 2 hours. This question assesses knowledge of a critical intervention for skin integrity and pressure ulcer prevention. The concept is proper turning schedules. To prevent pressure ulcers, also known as bed sores or decubitus ulcers, which result from prolonged pressure on the skin, residents who are immobile or have limited mobility should be repositioned at least every 2 hours. This relieves pressure on vulnerable areas, allowing blood flow to return. Regularly changing a resident's position, even more frequently if indicated, is a vital part of proactive skin care. Question 12. Which of the following is considered a normal change of aging for the integumentary system, skin? A. Skin becomes thicker and more elastic. B. Increased perspiration. C. Skin becomes thinner, drier, and more fragile. D. Reduced bruising. Answer: C. Skin becomes thinner, drier, and more fragile. This question tests your understanding of normal age-related changes, specifically concerning the skin. The concept is recognizing physiological changes that occur as people age, which directly impact care. As individuals age, their skin naturally loses elasticity, becomes thinner, and produces less oil, leading to dryness and increased fragility. This makes older adults more prone to skin tears and pressure ulcers. Understanding these changes helps CNAs provide appropriate and gentle skin care to residents. Question 13. A resident's call light is out of reach. What should the CNA do? A. Remind the resident to reach for it. B. Place the call light within the resident's reach. C. Tell the resident to yell if they need help. D. Leave the call light where it is to encourage movement. Answer: B. Place the call light within the resident's reach. This question focuses on resident safety and communication, a core responsibility of a CNA. The concept is ensuring residents have immediate access to assistance. The call light is a primary means for residents to request help, especially in emergencies, and must always be accessible to them. Placing it within reach prevents falls that might occur if the resident tries to get out of bed or chair to retrieve it. Always double-check that the call light is near the resident before leaving the room. Question 14. What is the purpose of providing privacy during personal care? A. To save time during the care process. B. To prevent other residents from observing. C. To protect the resident's dignity and rights. D. To allow the CNA to complete tasks without interruption. Answer: C. To protect the resident's dignity and rights. This question addresses a fundamental ethical principle in healthcare: respecting resident dignity and rights. The concept is understanding the importance of privacy in caregiving. Providing privacy, such as by closing doors or pulling curtains, upholds a resident's right to dignity and modesty during personal care activities like bathing or dressing. It's not about convenience but about respecting their personhood. Always remember that privacy is a cornerstone of person-centered care and resident rights. Question 15. The term NPO means: A. New patient order. B. Nothing by mouth. C. No pain observed. D. Next patient only. Answer: B. Nothing by mouth. This question tests your knowledge of common medical abbreviations that CNAs frequently encounter. The concept is understanding medical shorthand to ensure safe and accurate care. NPO is a Latin abbreviation for nil per os, meaning nothing by mouth. This order is critical and signifies that a resident should not be given any food, drink, or even gum, often before surgery or certain medical procedures. Always pay close attention to NPO orders, as giving anything by mouth could have serious consequences for the resident. Question 16. What is the most common cause of choking in residents? A. Eating too quickly. B. Drinking too much water. C. Dentures that fit poorly. D. Large, poorly chewed pieces of food. Answer: D. Large, poorly chewed pieces of food. This question focuses on resident safety, specifically preventing choking, which is a common and dangerous risk in long-term care. The concept is understanding the primary causes of choking to implement preventative measures. Large, poorly chewed pieces of food are the most common cause of choking because they can easily obstruct the airway. Ensuring residents eat slowly, take small bites, and chew thoroughly is essential. Remember to encourage residents to take their time and cut food into small, manageable pieces. Question 17. Which of the following is a sign of dehydration? A. Frequent urination. B. Swelling in the ankles. C. Dry mouth and cracked lips. D. Increased appetite. Answer: C. Dry mouth and cracked lips. This question tests your ability to recognize signs of a common and serious condition in elderly residents: dehydration. The concept is identifying physical indicators of fluid imbalance. Dry mouth, cracked lips, sunken eyes, and decreased urine output are common signs of dehydration. Frequent urination might be a symptom of other conditions. Swelling usually indicates fluid retention, and increased appetite is not directly related to dehydration. Promptly reporting signs of dehydration to the nurse is crucial for resident safety. Question 18. When feeding a resident, what is the proper position for them? A. Lying flat on their back. B. Semi-Fowler's position. C. Sitting upright at 90 degrees. D. Trendelenburg position. Answer: C. Sitting upright at 90 degrees. This question addresses safety during feeding, specifically preventing aspiration. The concept is understanding safe feeding positions. Residents should always be in an upright position, preferably sitting at a 90-degree angle, or as upright as possible, during meals. This position helps gravity move food down the esophagus and significantly reduces the risk of choking or aspiration, food or liquid entering the lungs. Keep the resident in this position for at least 30 minutes after eating to aid digestion and prevent reflux. Question 19. What should a CNA do first when discovering a fire in a resident's room? A. Attempt to extinguish the fire. B. Call the fire department. C. Remove residents from immediate danger. D. Locate the nearest fire extinguisher. Answer: C. Remove residents from immediate danger. This question tests your knowledge of fire safety protocols, often remembered by the acronym RACE. The concept is prioritizing safety actions during a fire emergency. The R in RACE stands for rescue/remove residents from immediate danger, which is always the first priority. Only after residents are safe should you activate the alarm, A, contain the fire, C, and then extinguish, E, if it's small and safe to do so. Always remember that saving lives is paramount in a fire situation. Question 20. A resident reports blurred vision and increased thirst. What vital sign should the CNA pay close attention to? A. Blood pressure. B. Temperature. C. Blood glucose. D. Oxygen saturation. Answer: C. Blood glucose. This question connects common resident complaints to a specific vital measurement, testing your ability to recognize potential health issues. Blurred vision and increased thirst, polydipsia, are classic symptoms of high blood glucose levels, often associated with diabetes. While all vital signs are important, these specific symptoms point directly to a possible imbalance in blood sugar. Reporting these observations and noting blood glucose readings are critical for the nurse to manage the resident's condition effectively. Question 21. What is the primary purpose of a restorative care program? A. To keep residents busy throughout the day. B. To help residents regain or maintain their highest level of function. C. To replace physical therapy treatments. D. To prepare residents for discharge from the facility. Answer: B. To help residents regain or maintain their highest level of function. This question clarifies the goal of restorative care, an important aspect of a CNA's role. The concept is understanding the aim of rehabilitation and reablement efforts. Restorative care focuses on helping residents maintain abilities they still have or regain abilities lost due to illness or injury, aiming for their highest possible level of independence and function. It is a continuous process that works alongside therapies, empowering residents to do as much as they can for themselves. For instance, encouraging a resident to dress themselves instead of doing it for them is a form of restorative care. Question 22. Which of the following is a CNA not permitted to do? A. Measure vital signs. B. Assist with activities of daily living, ADLs. C. Administer medications. D. Document resident care. Answer: C. Administer medications. This question assesses the legal scope of practice for a certified nursing assistant. The concept is understanding the boundaries of a CNA's responsibilities and tasks that are reserved for licensed nurses. CNAs are generally not permitted to administer medications, perform sterile procedures, or perform tasks that require independent nursing judgment. Measuring vital signs, assisting with ADLs, and documenting care are all within the CNA's scope. Always remember to stay within your scope of practice to ensure resident safety and legal compliance. Question 23. What is the first step in providing colostomy care? A. Apply a new ostomy bag. B. Empty the ostomy bag. C. Wash the stoma and surrounding skin. D. Don gloves. Answer: D. Don gloves. This question tests your understanding of infection control and the proper sequence for performing a procedure involving body fluids. The concept is implementing standard precautions consistently. Before any direct care involving potential contact with body fluids, such as colostomy care, the very first step is always to don appropriate personal protective equipment, starting with gloves. This protects both the CNA and the resident from the spread of microorganisms. Always prioritize putting on your gloves before touching anything soiled or potentially contaminated. Question 24. A resident is refusing to eat their meal. What is the CNA's best action? A. Take the tray away and come back later. B. Force the resident to eat. C. Offer alternatives or try to determine the reason for refusal. D. Document the refusal and do nothing else. Answer: C. Offer alternatives or try to determine the reason for refusal. This question addresses a common challenge in resident care and emphasizes person-centered approaches. The concept is promoting adequate nutrition while respecting resident autonomy. When a resident refuses food, the best approach is to explore the reason, e.g., pain, nausea, food preference, too hot/cold, and offer suitable alternatives or encourage small amounts, rather than forcing or simply removing the food. This shows respect for their choices and helps identify potential issues affecting their appetite. Question 25. What is the most appropriate way to communicate with a resident who has hearing impairment? A. Shout loudly to ensure they hear you. B. Speak slowly, clearly, and face the resident. C. Speak from another room. D. Use only written communication. Answer: B. Speak slowly, clearly, and face the resident. This question focuses on effective communication techniques for residents with sensory impairments. The concept is adapting communication to meet individual needs. Speaking slowly and clearly, facing the resident, to allow for lip reading if possible, and ensuring good lighting can significantly improve communication for those with hearing loss. Shouting can distort sound, and speaking from another room makes it impossible to hear. While written communication can be helpful, it should not be the only method. Question 26. When changing soiled linens for an incontinent resident, the CNA should wear: A. Only a mask. B. Gloves and a gown. C. Only gloves. D. No personal protective equipment, PPE. Answer: B. Gloves and a gown. This question assesses your knowledge of appropriate personal protective equipment, PPE, used for infection control when handling soiled materials. The concept is applying standard precautions in specific care situations. When changing soiled linens from an incontinent resident, there is a high likelihood of contact with body fluids, urine/feces, and potential splashing. Therefore, both gloves and a gown are necessary to protect the CNA's skin and clothing from contamination. Question 27. What is the primary purpose of hospice care? A. To cure a terminal illness. B. To provide aggressive medical treatments. C. To provide comfort and support to individuals with terminal illnesses and their families. D. To prepare residents for discharge to their homes. Answer: C. To provide comfort and support to individuals with terminal illnesses and their families. This question defines the core philosophy of hospice care, an important aspect of end-of-life support. The concept is understanding the goals of palliative and end-of-life care. Hospice care focuses on providing comfort, managing symptoms, and offering emotional and spiritual support to individuals who are terminally ill, typically with a prognosis of 6 months or less to live, and their families. It emphasizes quality of life over curative treatments. It's about living fully until the very end, with dignity and comfort. Question 28. A resident is complaining of pain. What is the best initial action for the CNA? A. Tell the resident to try to ignore it. B. Give the resident pain medication. C. Report the resident's pain to the nurse immediately. D. Document the pain at the end of the shift. Answer: C. Report the resident's pain to the nurse immediately. This question highlights the importance of timely reporting and resident comfort. The concept is the CNA's role in pain management. CNAs cannot administer medication, but they are crucial in identifying and reporting pain. Reporting pain promptly to the nurse is essential because pain can indicate a new or worsening condition and significantly impact a resident's well-being. The nurse can then assess the pain, administer appropriate medication, or implement other interventions. Question 29. When performing oral care for an unconscious resident, what position should the resident be in? A. Supine, lying flat on back. B. On their side, head turned to the side. C. Fowler's position, sitting upright. D. Trendelenburg position, head lower than feet. Answer: B. On their side, head turned to the side. This question focuses on safety during oral care for residents who cannot protect their own airway. The concept is preventing aspiration in unconscious individuals. When providing oral care to an unconscious resident, it is critical to position them on their side with their head turned to the side. This allows any fluids or secretions to drain out of the mouth, preventing them from being aspirated, inhaled into the lungs, which could lead to pneumonia. Aspiration is a significant risk for unconscious residents. Question 30. Which resident right allows them to refuse treatment? A. Right to privacy. B. Right to make independent choices. C. Right to participate in their care. D. Right to be free from abuse. Answer: B. Right to make independent choices. This question tests your knowledge of resident rights, a foundational component of CNA practice. The concept is understanding a resident's autonomy. The right to make independent choices includes the right to refuse treatment, even if that refusal is not in their best medical interest, as long as they are deemed competent to make that decision. CNAs must respect this right and report any refusal to the nurse. This right emphasizes that residents have control over their own healthcare decisions. Question 31. What is the primary reason for encouraging residents to participate in activities of daily living, ADLs? A. To save CNA time. B. To allow residents to socialize. C. To promote independence and self-esteem. D. To make the residents tired so they sleep better. Answer: C. To promote independence and self-esteem. This question focuses on the philosophy behind encouraging resident participation in their own care. The concept is promoting independence and self-efficacy through restorative care. Encouraging residents to do as much as they can for themselves, even if it takes longer, helps maintain their physical function, promotes independence, and significantly boosts their self-esteem and sense of purpose. This is a core principle of person-centered and restorative care. Question 32. What should a CNA do if they suspect a resident is being abused? A. Confront the suspected abuser directly. B. Ignore the suspicion if there's no clear proof. C. Report the suspicion to the nurse immediately. D. Discuss it with other CNAs first. Answer: C. Report the suspicion to the nurse immediately. This question addresses a critical ethical and legal responsibility for CNAs regarding resident safety. The concept is mandatory reporting of suspected abuse. CNAs are mandated reporters, meaning they are legally required to report any suspicion of abuse, physical, emotional, sexual, financial, neglect, or exploitation to their supervisor, the nurse, immediately. It is not the CNA's role to investigate or confront, but to report. Protecting residents from harm is a paramount duty. Question 33. When measuring a resident's radial pulse, where should the CNA place their fingers? A. On the inside of the elbow. B. On the side of the neck. C. On the thumb side of the wrist. D. On the top of the foot. Answer: C. On the thumb side of the wrist. This question tests your practical knowledge of measuring vital signs, specifically pulse points. The concept is accurate pulse assessment technique. The radial pulse is commonly measured on the thumb side of the wrist, where the radial artery runs close to the surface. This is the most common and accessible site for routine pulse checks in adults. Understanding proper anatomical locations for vital sign measurement ensures accurate data collection. Question 34. What is the medical term for low blood sugar? A. Hyperglycemia. B. Hypoglycemia. C. Hypertension. D. Hypotension. Answer: B. Hypoglycemia. This question assesses your understanding of medical terminology related to blood glucose levels. The concept is recognizing terms for common medical conditions, especially those related to diabetes management. Hypoglycemia refers to low blood sugar, which can be a dangerous condition characterized by symptoms like shakiness, dizziness, confusion, and sweating. Hyperglycemia is high blood sugar, while hypertension and hypotension refer to high and low blood pressure, respectively. Question 35. A resident has a new order for nothing by mouth, NPO, after midnight. The CNA finds the resident drinking water at 0100. What is the CNA's immediate action? A. Allow the resident to finish the water. B. Take the water away and notify the nurse immediately. C. Document that the resident drank water. D. Give the resident a snack to go with the water. Answer: B. Take the water away and notify the nurse immediately. This question tests your critical thinking and response to a violation of a critical medical order. The concept is adherence to NPO orders and immediate reporting of deviations. An NPO order means absolutely nothing by mouth, and violating it can have serious health consequences, especially before surgery. The CNA must immediately stop the resident from consuming anything and report this breach to the nurse without delay. This ensures the nurse can assess the situation and determine the next steps. Question 36. What is the correct way to identify a resident before providing care? A. Ask the resident, "Are you Mrs. Smith?" B. Check the resident's wristband and ask them their name. C. Look at the name on the door. D. Rely on your memory of the resident. Answer: B. Check the resident's wristband and ask them their name. This question focuses on a fundamental safety procedure in healthcare: resident identification. The concept is ensuring the right resident, right care principle. The safest and most accurate way to identify a resident is to use at least two identifiers, such as checking their wristband against the care plan or assignment sheet, and verbally asking them to state their name and date of birth. Simply asking, "Are you Mrs. Smith?" allows for a yes even if it's the wrong resident. Always verify identity thoroughly before any care. Question 37. When providing foot care to a resident with diabetes, what is especially important for the CNA to observe for? A. Long toenails. B. Shiny, healthy skin. C. Sores or breaks in the skin. D. Excessive hair growth. Answer: C. Sores or breaks in the skin. This question highlights a critical aspect of specialized care for residents with diabetes. The concept is understanding increased risks for specific conditions. Residents with diabetes are at high risk for poor circulation and nerve damage, which can lead to serious foot complications, including slow-healing sores, infections, and even amputations. Therefore, careful observation for any skin breakdown, redness, swelling, or open sores is paramount during foot care. Always be vigilant for any changes in the feet of diabetic residents. Question 38. What is the recommended hand-washing time for routine hand hygiene with soap and water? A. 5 to 10 seconds. B. 10 to 15 seconds. C. 20 seconds. D. 1 minute. Answer: C. 20 seconds. This question tests your knowledge of fundamental infection control practices. The concept is proper hand hygiene technique. The Centers for Disease Control and Prevention, CDC, recommends washing hands with soap and water for at least 20 seconds to effectively remove germs. This duration ensures enough time for friction and lather to break down and wash away microorganisms. Proper hand hygiene is the single most important way to prevent the spread of infection. Question 39. A resident is experiencing dyspnea. What does this mean? A. Difficulty swallowing. B. Difficulty breathing. C. Painful urination. D. Increased heart rate. Answer: B. Difficulty breathing. This question tests your knowledge of common medical terminology related to respiratory issues. The concept is understanding terms for symptoms that require immediate attention. Dyspnea is the medical term for difficulty breathing or shortness of breath. This is a symptom that always needs to be reported to the nurse immediately, as it can indicate a serious respiratory or cardiac problem. Recognizing such terms helps CNAs communicate effectively about a resident's condition. Question 40. Which vital sign is most indicative of infection in a resident? A. Blood pressure. B. Pulse rate. C. Respiratory rate. D. Temperature. Answer: D. Temperature. This question relates symptoms to specific vital signs. The concept is recognizing that an elevated temperature, fever, is a primary indicator of infection. While other vital signs can also be affected by infection, a rise in body temperature is the most direct and common physiological response to an invading pathogen. Therefore, when you observe a resident with a fever, it's a strong clue that an infection might be present, and it requires immediate reporting to the nurse. Question 41. When assisting a resident with a transfer from bed to wheelchair, where should the wheelchair be positioned? A. On the resident's strong side, next to the bed. B. On the resident's weak side, next to the bed. C. At the foot of the bed. D. Across the room from the bed. Answer: A. On the resident's strong side, next to the bed. This question focuses on safe transfer techniques, particularly for residents with unilateral weakness. The concept is proper body mechanics and resident positioning for safe transfers. Positioning the wheelchair on the resident's strong side allows them to use their stronger leg and arm to pivot and support themselves during the transfer, maximizing their independence and reducing the risk of falls. Always ensure the wheelchair is locked before starting the transfer. Question 42. What is the most important reason for reporting changes in a resident's condition to the nurse? A. To complete charting for the shift. B. To ensure prompt assessment and appropriate intervention. C. To avoid confrontation with family members. D. To show the nurse you are observant. Answer: B. To ensure prompt assessment and appropriate intervention. This question emphasizes the critical role of the CNA in observing and reporting changes. The concept is the importance of timely communication in resident care. Any change in a resident's physical or mental condition, no matter how subtle, could indicate a serious underlying health issue or a worsening of an existing one. Prompt reporting allows the nurse to assess the resident, determine the cause, and implement necessary interventions quickly, potentially preventing further complications. Question 43. What is the proper technique for removing soiled gloves? A. Pull one glove off by the fingers, then use that glove to pull off the second glove from the wrist. B. Pinch the palm of one glove and pull it off, then use that hand to pull off the second glove from the inside cuff. C. Pinch one glove at the wrist, pull it off inside out, then use the ungloved hand to pull off the second glove from the inside cuff, turning it inside out. D. Pull both gloves off at the same time, starting from the fingers. Answer: C. Pinch one glove at the wrist, pull it off inside out, then use the ungloved hand to pull off the second glove from the inside cuff, turning it inside out. This question assesses your knowledge of proper infection control practices, specifically safe glove removal. The concept is preventing self-contamination during PPE removal. The correct method ensures that the contaminated outer surface of the gloves never touches your bare skin, and the gloves are turned inside out as they are removed, containing pathogens. Always remember to perform hand hygiene immediately after removing gloves to complete the infection control process. Question 44. A resident is on strict bed rest. What activity could the CNA assist them with to promote circulation and prevent complications? A. Active range of motion, AROM, exercises. B. Passive range of motion, PROM, exercises. C. Ambulation in the hallway. D. Standing at the bedside. Answer: B. Passive range of motion, PROM, exercises. This question focuses on interventions for immobility and complication prevention. The concept is understanding the benefits of range of motion, ROM, exercises. For a resident on strict bed rest, who cannot move independently, passive range of motion, PROM, exercises performed by the CNA help to maintain joint flexibility, improve circulation, and prevent complications like contractures, shortening of muscles, and blood clots. Active ROM involves the resident moving themselves, while ambulation and standing are not appropriate for strict bed rest. Question 45. Which observation about a resident's urine should always be reported to the nurse? A. Clear, pale yellow urine. B. Urine with a slight odor. C. Cloudy urine with a strong odor. D. Urine output of 1,500 milliliters in 24 hours. Answer: C. Cloudy urine with a strong odor. This question tests your ability to identify abnormal observations related to elimination. The concept is recognizing signs of potential urinary tract infection, UTI, or other issues. Clear, pale yellow urine is normal, and a slight odor is also normal. However, cloudy urine with a strong, foul odor is a strong indicator of a urinary tract infection, UTI, or dehydration and requires immediate reporting to the nurse for assessment and potential treatment. Normal urine output is generally 1,000 to 1,500 milliliters, so 1,500 milliliters is within normal limits. Question 46. What is the purpose of placing a gait belt on a resident during ambulation? A. To restrict the resident's movement. B. To provide a secure grasp for the CNA to assist with balance and support. C. To prevent the resident from sitting down. D. To keep the resident's clothes from getting dirty. Answer: B. To provide a secure grasp for the CNA to assist with balance and support. This question focuses on safety equipment used during ambulation. The concept is understanding the proper use and purpose of a gait belt. A gait belt, also known as a transfer belt, is applied around a resident's waist to provide the CNA with a secure and firm grasp point during transfers or ambulation. It allows the CNA to stabilize the resident and prevent falls without pulling on their arms or clothing. It is a vital tool for ensuring resident safety during movement. Question 47. A CNA is assisting a resident with eating. The resident begins to cough forcefully. What should the CNA do first? A. Perform abdominal thrusts, Heimlich maneuver. B. Encourage the resident to continue coughing. C. Give the resident water to drink. D. Call for the nurse immediately. Answer: B. Encourage the resident to continue coughing. This question addresses immediate response to a choking incident. The concept is differentiating between partial and complete airway obstruction. If a resident is coughing forcefully, it means they are still able to move air, indicating a partial airway obstruction. In this situation, the best initial action is to encourage them to continue coughing, as this is the body's natural and most effective way to clear the airway. Only if the coughing stops or becomes ineffective should the CNA perform the Heimlich maneuver and call for help. Question 48. What is the most important reason to answer a resident's call light promptly? A. To avoid being disciplined. B. To ensure resident safety and address their needs. C. To keep the nursing station quiet. D. To reduce the number of times it rings. Answer: B. To ensure resident safety and address their needs. This question emphasizes a core responsibility and best practice for CNAs. The concept is prompt response to resident needs and prioritizing safety. Answering call lights promptly is crucial for resident safety, as they might be in pain, need to use the bathroom, preventing falls, or be experiencing a medical emergency. Delaying response puts the resident at risk and can lead to frustration or distress. Always remember that the call light is the resident's lifeline to help. Question 49. How should a CNA communicate with a resident who speaks a different language? A. Speak louder and faster. B. Use gestures and pictures, and seek an interpreter if possible. C. Avoid communicating with the resident altogether. D. Expect the resident to understand your language. Answer: B. Use gestures and pictures, and seek an interpreter if possible. This question addresses effective communication with diverse populations. The concept is cultural competence and overcoming language barriers. When a language barrier exists, CNAs should use simple words, gestures, and visual aids. Most importantly, they should inform the nurse to arrange for a professional interpreter or a facility-approved translation service, which ensures accurate and comprehensive communication. Avoiding communication or expecting understanding is unprofessional and unsafe. Question 50. What is a care plan in a healthcare setting? A. A daily schedule for the CNA's tasks. B. A legal document outlining the resident's wishes for their funeral. C. An individualized written plan of care developed to meet the resident's needs. D. A list of all medications the resident is taking. Answer: C. An individualized written plan of care developed to meet the resident's needs. This question defines a fundamental document in resident care. The concept is understanding the purpose and content of a care plan. A care plan is a dynamic, individualized guide that outlines the resident's specific needs, problems, and the interventions, actions, healthcare staff should take to address those needs. It ensures consistent, person-centered care and includes input from the resident, family, and various healthcare professionals. The CNA's daily tasks are guided by this comprehensive plan. Question 51. When assisting a resident with dressing, which item of clothing should be put on first? A. Shirt. B. Pants. C. Underwear. D. Socks. Answer: C. Underwear. This question pertains to the proper sequence of dressing a resident for efficiency and dignity. The concept is basic personal care sequencing. When assisting with dressing, underwear should always be put on first. This maintains the resident's modesty and provides a foundation for other clothing items. It's a simple step that helps ensure dignity and proper layering during the dressing process. Question 52. What is the normal range for adult oral temperature? A. 95.6 to 97.6 degrees Fahrenheit. B. 97.6 to 99.6 degrees Fahrenheit. C. 99.6 to 101.6 degrees Fahrenheit. D. 100.0 to 102.0 degrees Fahrenheit. Answer: B. 97.6 to 99.6 degrees Fahrenheit. This question tests your knowledge of normal vital sign parameters. The concept is recognizing the typical range for an adult's oral temperature, which is crucial for identifying fever or hypothermia. While minor variations can occur, the average oral temperature is 98.6 degrees Fahrenheit 37 degrees Celsius, with a normal range generally considered to be 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. Knowing these ranges helps you identify abnormal findings that need to be reported to the nurse. Question 53. If a resident has a history of falls, what safety measure should the CNA prioritize? A. Placing the resident in a room furthest from the nursing station. B. Keeping the bed in the highest position at all times. C. Ensuring the call light is within reach and responding promptly. D. Encouraging the resident to wear loose-fitting clothing. Answer: C. Ensuring the call light is within reach and responding promptly. This question focuses on fall prevention strategies for high-risk residents. The concept is proactive measures to enhance resident safety. For a resident with a fall history, ensuring immediate access to the call light and prompt response to it is paramount. This allows the resident to request help rather than attempting to get up unsupervised, significantly reducing fall risk. The bed should be kept in the lowest position, and loose clothing can be a tripping hazard. Question 54. What is the most important factor in maintaining a resident's dignity and self-respect? A. Allowing them to wear their own clothes. B. Always addressing them by their first name. C. Encouraging them to watch TV all day. D. Doing everything for them to save time. Answer: A. Allowing them to wear their own clothes. This question highlights aspects of person-centered care and respecting individuality. The concept is promoting dignity through personal choice and routine. Allowing residents to wear their own clothes, choose their activities, and maintain personal routines helps them retain a sense of identity, normalcy, and control over their lives, which are vital for dignity and self-respect. Addressing them by their preferred name and allowing choices are also important, but wearing their own clothes is a tangible symbol of their continued individuality. Question 55. What does the abbreviation ADL stand for? A. Acute daily living. B. Assisted daily logistics. C. Activities of daily living. D. Aide for disoriented learners. Answer: C. Activities of daily living. This question tests a very common abbreviation in healthcare. The concept is understanding common acronyms used in daily care. ADL stands for Activities of Daily Living, which are routine self-care tasks that people typically do every day, such as bathing, dressing, grooming, eating, toileting, and ambulating. CNAs provide significant assistance with ADLs, and understanding this term is fundamental to their role. Question 56. When taking a resident's blood pressure, the CNA should ensure the arm is A. Hanging loosely by their side. B. Elevated above heart level. C. At heart level. D. Tucked under their body. Answer: C. At heart level. This question focuses on accurate blood pressure measurement technique. The concept is proper positioning for reliable vital sign readings. To get an accurate blood pressure reading, the resident's arm, where the cuff is placed, should be supported and positioned at the same level as their heart. If the arm is too high or too low, the reading will be inaccurate. Proper positioning is key to obtaining correct and useful data for the nurse. Question 57. What is considered neglect in a healthcare setting? A. Threatening a resident with physical harm. B. Forgetting to tell a resident their family visited. C. Failing to provide needed care, resulting in harm or risk of harm. D. Taking a resident's personal belongings without permission. Answer: C. Failing to provide needed care, resulting in harm or risk of harm. This question addresses a serious legal and ethical issue in healthcare: neglect. The concept is recognizing different forms of abuse and misconduct. Neglect occurs when a caregiver fails to provide the necessary care, services, or supervision that a resident requires for their health and well-being, leading to actual harm or placing them at risk of harm. This includes things like not providing hygiene, nutrition, hydration, or repositioning. CNAs are mandated to report any suspected neglect. Question 58. A resident is refusing their morning bath. What should the CNA do? A. Force the resident to take a bath. B. Tell the resident they will not get breakfast if they don't bathe. C. Ask the resident why they are refusing and offer to try later or offer an alternative. D. Report the refusal to the nurse and skip the bath. Answer: C. Ask the resident why they are refusing and offer to try later or offer an alternative. This question tests your approach to resident refusal, emphasizing resident rights and problem solving. The concept is respecting resident autonomy while still promoting care. When a resident refuses care, the best approach is to understand their reason, e.g., pain, cold, not feeling well, preference, and offer alternatives, e.g., a partial bath instead, bathing at a different time. Forcing care or using threats is a violation of rights. If refusal persists, report it to the nurse. Question 59. When assisting a resident who is visually impaired with ambulation, where should the CNA walk? A. Slightly behind the resident. B. In front of the resident, holding their hand. C. Slightly ahead of and to the side of the resident, offering an arm. D. Completely separate from the resident, just giving verbal directions. Answer: C. Slightly ahead of and to the side of the resident, offering an arm. This question focuses on safe and supportive ambulation techniques for residents with visual impairments. The concept is guiding a visually impaired person effectively. Walking slightly ahead and to the side allows the CNA to act as a guide, providing a steady arm for the resident to hold. This position also allows the CNA to anticipate obstacles and verbally describe the environment, making the resident feel more secure and guiding them safely. Question 60. What is the correct procedure for emptying a urinary drainage bag? A. Empty it only when it is completely full. B. Clamp the tube, open the drain, empty, close the drain, unclamp. C. Wipe the drain with alcohol after emptying. D. Empty it into the toilet and then rinse the bag with cold water. Answer: B. Clamp the tube, open the drain, empty, close the drain, unclamp. This question tests the practical procedure for maintaining a urinary drainage system. The concept is proper catheter care to prevent infection. The correct sequence involves clamping the tubing to prevent backflow into the bladder, opening the drain, emptying the urine, closing the drain securely, and then unclamping the tubing. Wiping with alcohol is not typically part of the routine procedure for emptying, and rinsing the bag is generally not recommended as it could introduce pathogens. Question 61. What is the proper technique for measuring a resident's weight on a standing scale? A. Have the resident wear shoes and a heavy coat. B. Weigh the resident at different times of day. C. Ensure the scale is balanced at 0 before the resident steps on it. D. Measure weight after a large meal. Answer: C. Ensure the scale is balanced at 0 before the resident steps on it. This question focuses on accurate measurement techniques. The concept is ensuring precise weight readings, which are crucial for monitoring fluid balance and nutritional status. To obtain an accurate weight, the scale must be balanced or calibrated to 0 before the resident steps on it. The resident should also wear minimal clothing and be weighed at the same time of day, ideally before breakfast and after voiding, for consistent measurements. Question 62. Which action promotes a resident's independence during mealtime? A. Cutting all their food into very small pieces before serving. B. Feeding the resident without asking if they need help. C. Allowing the resident to use adaptive eating utensils if needed. D. Telling the resident to eat quickly to finish the meal. Answer: C. Allowing the resident to use adaptive eating utensils if needed. This question addresses promoting independence, a key aspect of restorative care during meal times. The concept is empowering residents to self-feed. Offering adaptive utensils, e.g., weighted spoons, plate guards, empowers residents with limited mobility or tremors to feed themselves, fostering independence and dignity. Cutting all food beforehand or rushing the resident can take away their autonomy. Always encourage residents to do as much as they can for themselves. Question 63. What should a CNA do if a resident falls while ambulating with them? A. Try to stop the fall completely by holding them up. B. Break the fall by easing the resident to the floor. C. Pull the resident back up immediately. D. Leave the resident and go get the nurse. Answer: B. Break the fall by easing the resident to the floor. This question addresses immediate response to a fall, prioritizing safety for both the resident and the CNA. The concept is safe fall intervention. If a resident begins to fall, the CNA should try to ease them gently to the floor rather than attempting to prevent the fall completely. This controlled descent minimizes injury to the resident and prevents the CNA from injuring their own back. Once on the floor, the CNA should stay with the resident and call for help. Question 64. A resident is experiencing confusion and disorientation. What is the most appropriate action for the CNA? A. Argue with the resident about their confusion. B. Reorient the resident to reality, e.g., time, place, person, gently and calmly. C. Ignore the behavior, as it is just confusion. D. Restrain the resident to prevent wandering. Answer: B. Reorient the resident to reality, e.g., time, place, person, gently and calmly. This question addresses managing cognitive impairment, specifically confusion and disorientation. The concept is providing supportive and reality-based care. When a resident is confused, gently reorienting them by reminding them of the date, time, location, and who you are, in a calm and reassuring manner, can help reduce distress and promote clarity. Arguing or ignoring the resident is unhelpful, and restraints are a last resort, used only for safety after other interventions fail. Question 65. What is the appropriate response when a resident requests pain medication from a CNA? A. Tell them you will get it for them. B. Administer an over-the-counter pain reliever. C. Inform the nurse of the resident's request. D. Tell the resident to wait until the nurse makes rounds. Answer: C. Inform the nurse of the resident's request. This question reinforces the CNA's scope of practice regarding medication administration. The concept is the division of responsibilities in patient care. CNAs are not permitted to administer any medications, including pain relievers. When a resident requests pain medication, the CNA's correct and only action is to immediately report the resident's pain and their request to the licensed nurse, who is authorized to assess and administer medication. Question 66. When assisting a resident with eating, what temperature should liquids be served at? A. Extremely hot. B. Extremely cold. C. A comfortable, safe temperature. D. Room temperature only. Answer: C. A comfortable, safe temperature. This question addresses safety during feeding. The concept is preventing burns or discomfort from liquids. Liquids, such as coffee, tea, or soup, should always be served at a comfortable, safe temperature, checking it first on your wrist to ensure it's not too hot or too cold for the resident. Extremely hot liquids pose a burn risk, especially for residents with decreased sensation or cognitive impairment, while extremely cold liquids might cause discomfort. Question 67. What is the purpose of standard precautions in infection control? A. To prevent the spread of disease from residents with known infections only. B. To protect healthcare workers from all types of illnesses. C. To protect everyone by treating all body fluids as potentially infectious. D. To isolate residents with specific contagious diseases. Answer: C. To protect everyone by treating all body fluids as potentially infectious. This question defines a core principle of modern infection control. The concept is universal application of infection prevention measures. Standard precautions are a set of infection control practices used to prevent the transmission of diseases that can be acquired by contact with blood, body fluids, non-intact skin, and mucous membranes. They are applied to all residents, regardless of their diagnosis or presumed infection status, assuming all body fluids are potentially infectious. Question 68. How can a CNA best promote a resident's sleep? A. Encourage them to nap frequently during the day. B. Ensure their room is bright and noisy at night. C. Provide a comfortable, quiet, and dark environment at night. D. Offer caffeinated beverages before bedtime. Answer: C. Provide a comfortable, quiet, and dark environment at night. This question addresses interventions to support a resident's rest and sleep. The concept is creating an optimal sleep environment. To promote sleep, a CNA should ensure the resident's room is quiet, dark, and at a comfortable temperature, and reduce interruptions at night. Napping too much during the day or consuming caffeine can interfere with nighttime sleep. Promoting a conducive environment is key to a good night's rest. Question 69. Before leaving a resident's room, what is the most important final check for the CNA to make regarding safety? A. Ensure the TV is on. B. Check that the bed is in the lowest position and call light is within reach. C. Make sure the window is open for fresh air. D. Ensure all personal belongings are on the bedside table. Answer: B. Check that the bed is in the lowest position and call light is within reach. This question focuses on crucial safety checks before leaving a resident's room. The concept is preventing falls and ensuring access to help. The absolute most important final check is to ensure the bed is in its lowest safe position to prevent falls if the resident tries to get out, and that the call light is within their immediate reach so they can summon help when needed. These two actions are fundamental to resident safety in their environment. Question 70. What is the purpose of documenting care provided to a resident? A. To justify the CNA's work hours. B. To provide a legal record of care and communicate information to the healthcare team. C. To determine the resident's daily preferences. D. To prepare for annual inspections only. Answer: B. To provide a legal record of care and communicate information to the healthcare team. This question addresses the fundamental importance of accurate documentation in healthcare. The concept is the purpose and legal significance of charting. Documentation serves as a legal record of the care provided, ensuring accountability and continuity of care. It also acts as a vital communication tool among all members of the healthcare team, allowing them to stay informed about the resident's condition, treatments, and responses to care. Think of charting as telling the story of the resident's day and their health journey.